This is an overview of the Smart Telemedicine solution of H&S, a home care system providing telemonitoring for patients and the improvement of their therapeutic compliance. The solution includes a kit for collecting and sending data from several medical and environmental sensors at patient home to a central web portal through a hub, a web portal with discriminated and secure access that permits general practitioners and nurses to check data collected by sensors. The patient does not have to change his or her ways, and in the least invasive possible manner, gets help in the therapeutic compliance through a pills dispenser that, prepared with patient medications, permits an easy and assisted intake of therapy with a visual and audible signal. If the patient fails therapy despite the audible and visual signal, you can alert the caregiver through an SMS message. A successful therapy is stored by the pills dispenser and sent to the portal as a measure of the patient's compliance with therapy. Hermes is a home care hub that is characterized by a high capacity of connection to the telemedicine portal and for the bi-directionality of the managed information. Hermes is able to pick up signals from medical devices and environmental sensors through various protocols: Bluetooth, Z-Wave, USB, RS-232, Wi-Fi, and sending them to the central portal through 3G, Wi-Fi, ETH, PSTN. We see, for example, the optional receipt, both audible and visual, of a reminder for patient adherence to compliance measurement. The patient or the caregiver silences the alarm and undertakes the required action. All measurements are easily performed with certificate medical devices, without the intervention of the patient. This data is sent to the hub and then to the portal. Different types of medical devices are supported by the system, and their arrangement in the house must be the most comfortable and suited possible. For example, you can take the measurement of pulse oximetry with an easy-to-use device that, silently and without any intervention of the patient or the family, sends this measurement to the Hermes hub present in the domestic context. Data not directly measured by medical devices is collected with surveys that come to the patient or family members. On the hub, also at a later time, you can view all of the latest measurements. Hermes is also equipped with a mechanism, Call Me, that always through Bluetooth interface warns the family member about the local call of the patient with an audible and visible alert. The call is stopped locally or otherwise sent to the portal to support the patient remotely. Diabetic patients can independently measure blood glucose at home or on the move. We see a Bluetooth blood glucose meter used by the patient at home. If the patient uses the glucometer away from home, at his return, measurements are automatically sent to the hub. In telemedicine solution, the ECG with one derivation is integrated to calculate heart rate, breathing rate, activity level, body position, bioimpedance. Let's see how it is possible to wear the device at home with the use of a belt. The body gateway is able to intercept autonomously a series of events such as arrhythmias, abnormal frequencies, and it is equipped with a button at the disposal of the patient to report a situation of malaise and trace the event for diagnostic purposes. The ECG works and stores events also outside the house, allowing the monitoring also for a patient who goes out and then transfers the data collected when the patient falls in the range of hub home. For patients at risk of falling, a tool is available that calculates the amount of movement in units of time and intercepts fallen and/or the patient's emergency calls. Several devices are connectable with Hub Hermes to measure different parameters depending on the disease and comorbidities of the patient. For patients with reduced autonomy, it is also possible to integrate environmental sensors for measuring temperature, humidity, brightness, flooding sensors, smoke sensors, gas sensors. Hermes is a medical certificate for Europe and Canada Class 2A. Once collected, clinical and/or environmental data can be defined on the central portal thresholds, even complex, on several measures collected from the field and generate alarms visible to the web or sent asynchronously to the caregiver or nurse. Health Platform Portal can also collect complex examinations by medical devices. We can see an example of ECG events collected from the body gateway and displayed by the portal for the benefit of the doctor who gives medical reports about individual events. We see the agenda of the patient with scheduled events and, with different colors, the status of the events. In addition to data collected at home, you can enrich patients' dossier with a range of information directly charged by nurses related to events that occurred in the patient's medical history. It is possible to attach even complex clinical examinations carried out in a hospital or laboratory to the portal and associate to the patient profile for a patient file richer and more detailed as possible. Hermes and Health Platform are products of H&S Qualitane Software, medical certified in Class 2A according to the regulations of the European Economic Community.